So here is the case. I just decided to pull the first one, which was that external cause one with the burns. So let's look at this case. So our admission diagnosis is second-degree burn of the left plantar foot. Discharge diagnosis is the same, second-degree burn, left plantar foot, and then no concerns for non-accidental trauma. So again, they're trying to make sure that nothing else happened except for what was documented as the accident. So it tells us to seek the H&P, that we have a 7-year-old boy who stepped on the ashes of a campfire, which was still hot, which resulted in a left foot burn of the plantar surface. The patient had noxzema cream on toilet paper immediately placed on the injury, and he was brought to the ER where he was noted to be in severe pain and had nausea as well. The patient was medicated with multiple times of morphine and once with Zofran and had better pain control, and it was noted that the patient had significant partial thickness burns on 75% of the plantar surface of the left foot and a few minor blisters on the right foot. The patient apparently was trying to retrieve a lottery ticket which was thrown in the campfire. At the time of evaluation, he says his pain is a little, denied any other injuries at the time. So his past medical history: was born premature with very mild cerebral palsy, with slight spasticity at the lower extremities, currently otherwise no symptoms. He's able to run, walk, and climb. He may have future diagnosis of ADHD, but otherwise has normal developmental history. The remainder of the history is non-remarkable. The vitals are good. 7-year-old's well-nourished with blisters on the plantar surface of the left foot, including the pads of all his toes, and blistering on the arch of the right foot as well between the 4th and 5th digit. The remainder of the exam is normal. Hospital course: the patient's given 4 milligrams of morphine and Zofran to control his pain and nausea. The patient has foot soaked in sterile watery solution and then had his foot dressed with Silvadene cream and wrapped with sterile dressing. He was brought up to, the 4th floor for further pain control, though he required 1 further dose of IV morphine. By the next day, the patient required no medications, was quite comfortable, and he was tolerating the dressing change with the application of the Silvadene cream quite well. The patient had no abnormalities and vital signs, and his discharge was stable. Slightly elevated blood sugars, which were improving, and discharge medications were some more of that Silvadene cream used to keep it clean. Take a Vicodin if needed, and ibuprofen and Tylenol. The patient is able to stay on a flat foot until the blisters start to heal. The patient will require a wheelchair at home and further outpatient evaluation by physical therapy, and may provide him with a walker. He's going to follow up the wound clinic. So now if we go to the H&P, again we have a 7-year-old male with mild cerebral palsy who presents to the ED with mother for evaluation of left foot burn. This evening the patient was playing around a campfire while his family stepped into the fire, burning the bottom of the left foot and a small portion of his right foot. The mother applied substantial amount of a cream consisting of noxzema and toilet paper. The patient complains of severe pain and nausea, which subsequently reduced with pain medication in the ED. The immunizations are up to date, no allergies. So his history is cerebral palsy, diplegic, and chronic otitis externa. He does have a history of a tympanostomy, which is what is used to treat the otitis, right? It's just tubes in the ears. The patient is accompanied by his mother to the emergency department and has a sister. So he has nausea without vomiting. Everything else is negative. He has left foot burn. He's alert. He's acting appropriately. Everything else is atraumatic. So if we look at the skin, it's a second-degree burn to the ball of the left foot and pads of toes on plantar aspect. 75% of the foot, at this time sparing the heel. small blister to instep of the right foot plantar aspect. So the patient was placed in stabilization, had severe pain, so they gave him morphine and Silvadine to again dress the foot. So the impression is the second-degree burns of the left foot and 1% body surface area. So here's a great example when I told you that the physician typically will document the total body area burn. So not only do we code the burns individually, we also assign that code for the total body burn. So the documentation here supports that it's 1%. So the H&P is going to be similar to that ER report, but a 7-year-old boy who has a history of mild cerebral palsy who presents to the ED with his mother secondary to a foot burn from stepping on a campfire. Within the hour before presenting to the ED, the patient and his family were playing around a campsite where a fire had burned the previous night, and when something was thrown into the fire, the patient stepped into the fire to retrieve it. Small portions of his right foot were affected. The patient immediately had severe pain and fell to the ground but had no other injuries. Mother applied Noxzema cream and then covered it with light toilet paper and brought him immediately to the emergency room. The patient was very tearful and complained of severe pain as well as nausea after receiving pain medication upon arrival in the emergency room. At the time of evaluation, the patient's foot is soaking and he is easily distracted from his pain and says it only hurts a little. The patient was born premature between 28 and 38 weeks gestation. The patient may have had a brief pulmonary or cardiac arrest by report, although stepmother is the parent present. She was not present at the time, although then the acute course was well. The patient has a mild diagnosis of perhaps a mild cerebral palsy with very mild dysplasia with mostly toe walking, although this is corrected with shoes. Has been evaluated by specialists. However, he needs no orthotics, is able to ambulate, run, and has normal balance. Has some of the neurobehavioral issues associated with being born premature and may eventually be diagnosed with attention deficit hyperactivity disorder. He has had no hospitalizations since his NICU stay as a baby, chronic conditions, none, recurrent ear infections, but he had tubes put in, no allergies, immunizations are up to date. The patient lives for the most of the year with his stepmother and father. He spends 2 months a year with his mother. The patient has 3 other siblings who are all healthy. No other history of trauma or injuries. No abnormal risk-taking behavior, no indigestion. Patient small for his age, but is gaining weight consistently. There's no other issues. He did have nausea when he was treated, which was treated with the Zofran. No other issues there. Physical exam, everything's normal. Just kind of skim over these. Everything looks normal. And then when we get to the skin, again, they talk about the second-degree burn of the left foot and mostly the ball and the plantar surface of the toes, but the heel appears to be spared. Roughly 75% of the aspect of the foot with significant blistering. There's a small blister to the instep of the right foot as well as a small blister on the right fifth toe and lateral dorsal aspect. So his assessment is partial thickness burn, roughly 1 to 1.5%, or 0.5%, of the body area. Does not require significant orthopedic advancements due to location. Pain is a significant issue which required morphine. And the plan was to admit him, give him morphine, soak with sterile water, dress, give Zofran for nausea, Toradol for pain, and then crutch walking versus a wheelchair. Tylenol as needed, and glucose checks to make sure his sugars are under 200, his glucose is under 200. And our progress notes. So patient admitted with left burned foot, which is covered with a dressing. toes are visible and CMS is intact. Right foot has a blister on the fifth toe and a small dark area on the great toe. Silidine cream and dressing applied after foot wash. Patient is rating 4 out of 10 on a face pain scale. The stepmom is here and had to leave. She did call to get an update. Patient has not voided yet. He did eat oatmeal, toast, and ice cream along with a juice for dinner. His stepmom reports he has attention deficit and is easily distracted. Patient appears comfortable and is watching a movie. We'll continue to monitor and follow per protocol. And then discharge. Patient was discharged by a wheelchair. He used to follow up with the instructions that were given. Prescriptions were written and belongings were sent. Okay, and that's the last of that report. So if we go back to the discharge summary, remember we always want to read through it first and then go back to the discharge summary to make sure that we're capturing everything. So we're going to code the burns, right? We have a 2nd-degree burn of the left foot and of the right foot. They mentioned multiple times throughout that he had some blisters on the right foot as well. So we're going to code a 2nd-degree burn of the left foot, 2nd-degree burn of the right foot. We also know that our burn is less than 10% of the total body surface. One documentation said 1%, one said 1 to 1/2%. So either way, it's less than 10%. So we're going to code a total body surface burn is less than 10%. The patient had nausea multiple times. It was documented that he was given Zofran. So we're going to code the nausea because that's a symptom, but it's not typical with a burn, right? So that is something we're going to code in addition. And then we're also going to code the cerebral palsy that the patient had. And right here, it says the slight spasticity of the lower extremities currently. So the cerebral palsy, we're going to code the spastic, the ecplegic kind. And then we're going to code how the burn happened, which was the campfire. So we need to code the cause of the burn at the campfire, and then the place of the burn was a campsite, because that's where a campfire is. And then the other thing I wanted to point out is it said multiple times that he might have a future diagnosis of ADHD. So even though the stepmom reported that the patient has it, there hasn't been a definitive diagnosis by anyone yet. So we're not going to code ADHD because there's not a diagnosis made on this account, or he's not currently being treated for that. So that diagnosis has not been confirmed yet. It's just the stepmom said he had it, and so our physicians are saying it might be a diagnosis later, but it's not currently something we're coding.
So let's go ahead and look at the codes that we would assign. We would assign the T25.221A for the first burn, the T25.222A for the second burn, the T31.0 for the total body area burned. Then we're going to code the cerebral palsy, the G80.1, the nausea, the R11.0, and then we have to code again that this happened by him stepping in those hot ashes of the campfire and that the place of occurrence was that campsite. And those are coded with X03.8XXA. Again, A is for initial encounter. And then Y92.833 for the place of occurrence at a campsite.